Okay, good afternoon. I'm Rob Lash, president of Mosky Dental Lab in Cleveland, Ohio. And I'd like to thank you for taking your time today to participate in our webinar on AvaDent digital dentures. Although our lab turns 90 years old this year, we embraced the accuracy and speed of the digital world early on. As such, we began digitally designing our fixed substructures and milling zirconia in 2008, printing partial frameworks and milling custom abutments in 2010, and this year digitally fabricating full dentures. The AvaDent system has allowed us to do so, and as far as I'm concerned, its most important feature is that it works in our hands. Therefore, it will work for you, and most importantly, for your patients. Before I introduce Dr. Finger, our presenter today, I want to let you know that you have the ability to ask a question at any time by clicking on the raised hand button, and your mic or phone line will be unmuted at that time so others will be able to hear you. Also, at the end of the webinar, there will be an offer of which you'll want to take advantage. So, now I'm happy to introduce Dr. Israel Finger, who specializes in removable prosthetics and implant restorations. He received his master's degree in prosthodontics from The Ohio State University, followed by additional specialized training in maxillofacial prosthetics at Roswell Park Institute in Buffalo. For 28 years, Dr. Finger has been a professor at the LSU Medical Center, where he was director of the graduate program in prosthodontics. He has lectured extensively, both nationally and internationally, and has authored numerous journal articles and contributed to textbooks. Dr. Finger will give you an overview of the clinical aspects of AvaDent as well as some of the other benefits. And so, Dr. Finger, if you will.
Thank you very much, Rob. Good morning, everybody. It's a delight to be with you. And as Mike said and Rob said, please, at any time, go right ahead. And if you need to ask questions, raise your hand, and we'll try and answer them, or I'll try and answer them for you. This is an interesting slide. Now, when I think of AvaDent, one of the best ways I personally have found of truly articulating this high-tech image of AvaDent, which is truly a remarkable digital product, is to make a comparison to Apple. Steve Jobs was always looking for ways to put all of his electronics and his algorithms into a small technical black box so that his products could be simple and elegant to use for the user. AvaDent is the first and only computer-aided engineering digital denture that is available at the present time. You see the term computer-aided engineering. AvaDent actually is using a breakthrough digital technology. It's a platform using computer-aided engineering. So what is this? Computer-aided engineering and CAD/CAM uses algorithms to control the bulk of design and manufacturing tasks. You, the dentist, can treat and plan a removable prosthesis, whether it's an immediate denture, an all-on-4, a complete denture over complete denture, to a full mouth rehab with your laboratory using only digital technology. There is some part clinically that you must do, and that is to make records and make impressions, but from there on, everything is done digitally. A true breakthrough in the art of complete dentures. If we look at the AvaDent, we know that there is very sophisticated technology, and this is based on removable prosthodontic principles. For instance, the design of the occlusal plane, incisal guidance, recognizing anatomical landmarks on the virtual casts which are sent in, have all already been pre-planned so that when your denture comes in to be made, it is very easy to plan your prosthesis based on the information already in the software. It is a simple clinical process. It truly is great results. You'll see that when I describe the clinical processes to you, you will find that these are processes which you have used in your office for many years and can now apply this to the AvaDent denture. It's a premium product. It uses premium materials. The resins used are even the AvaClar or Dentsply resins. Teeth are used, Dentsply and AvaClar teeth, plus a number of other companies, so that the materials are state-of-the-art. The system allows you to do a true full mouth rehabilitation, in as much that techniques have now been developed to allow you to do an all-on-4 or immediate load, or a simple process such as simply making a single arch restoration. The final prosthesis is fully milled, and therefore you have 100% accuracy with no shrinkage of any resins that the prosthesis is made out of. And you'll find that by doing the AvaDent, you'll reduce chair time. I think you'll find simplified record making easy. And then, of course, your lab will scan your records, send this off to AvaDent, who will complete your restoration. It's quite neat to note that you have a permanent digital record of your patient's prostheses, so at any time if this is lost, your patient will be able to receive an exact duplicate of the lost prosthesis within 48 hours. Most important, it is made of a biohygienic material, and I will explain this. So the benefits to your patient are that there will be a reduced chair time. We believe that you do have a superior fit, permanent record, and by biohygienic materials, we note that the material, which is made out of puck of resin, this puck is produced under an enormous amount of pressure and heat. There is no shrinkage. It is very hard, and very small amounts of Candida are able to grow onto this material. It is less porous, so that comparison to the lost wax technique, there will be no free monomer after the restoration has been completed. What about for you? You will use standard clinical procedures. I think you'll find that once you get au fait with the product, it will reduce the chair time. It's precision milled. The retention is excellent of the final restoration. It is digitally designed. You can customize the restoration according to your specific needs. And as I pointed out, it has reduced monomer, and there is a patented puck process which allows no microporosity, no shrinkage, and less Candida albicans adherence. So from a profitability point of view, I think you'll find that having your patient seated fewer times allows you that time to visit with other patients. So if I was doing this, and I have an old method to do this, using the lost wax technique, we generally take about 5 or 6 appointments to complete the restoration. By doing an AvaDent, you will take your records at the first appointment, and then you're able to deliver a denture of high quality at the second appointment. The denture will be quite aesthetic, and you will, with your technician, through Mosky Lab, actually be able to define the final setup prior to completion. There are many removable restorations that that AvaDent can produce for you. The complete dentures were our very first restoration, and then we moved into single restorations. Immediate dentures are available, and now the all-on-4 with a patented system devised by AvaDent is available for you to use on those patients on whom you wish to have immediate loading. In addition, the question that often comes up is, well, you're finishing in 2 appointments, but what happens if I don't like the final restoration? And if you wish to do a try-in, this is available to you after the denture teeth have been preliminarily set and accepted by your lab. The teeth can be set in wax. You can check this in the mouth. Alternatively, a resin, a denture made out of a white resin can be made and milled and sent to you to try in the mouth, which you will see as we develop this lecture. So what we have is a digital record that you will have for your patient, and everything you see from now onwards will be that the denture can be constructed digitally. There are 2 clinical procedure options. One is the one we call a reference denture record, and this can be used, I believe, in your office between 65 to 70% of the cases. Or you can use an intraoral tracer called the anatomical measuring device, specifically and mainly when you cannot use the patient's old dentures as a record procedure, or alternatively when the patient does not have dentures. So with the RDRP procedure, which is the reference denture, the existing denture that the patient might be wearing is analyzed, and we assess whether or not this might be used for adequate record making. And if it is, we can go ahead and duplicate that denture and use this to record vertical dimension, centric relation, and actually do a mock-up on that particular duplicated denture. If the existing denture is adequate for the occlusal vertical dimension, but cannot be used as a custom tray to make a final impression, then a separate final impression is made. So all in all, what you're doing here is you're making a final impression in your duplicated denture and continue to make a record. And like I said, with the anatomical measuring device, if the patient is totally dentureless with no denture, or if the dentures that they have fit so poorly and you cannot use them, in your opinion, to duplicate and make final records, then you will use the anatomical measuring device. Well, let's have a look at how the RDRP will be used in your office. In the kit, you're provided with a Lang's duplicator and a number of different materials, including resin. You have alginate in the office, and you will go ahead and duplicate the patient's old denture. Here is a patient who presents. Teresa wanted to have a new complete denture made. We can see that there is a total reverse smile on this patient. She does have a partial denture in the lower arch, but doesn't want to have that remade. Using the alginate mix, this is mixed and placed. The first layer is placed into the lower component of the duplicating flask. The denture is placed into this. Alginate is allowed to set, and then a second layer of alginate is poured into the denture impression surface, and the alginate allowed to set. The flask is opened, the resin is mixed, poured into the flask, and what we have is a duplicated denture. This denture will now be used as a record-making device. You can go ahead and make an impression in this denture, and once the impression is made, you can then begin to assess the patient's vertical dimension, and you'll be able to record the centric relation record with this. Here we see on Teresa, this is her duplicated denture. I'm going to increase the vertical dimension using some wax. You can use composite resin, you can use acrylic resin, As pointed out, she had a reverse smile, and here we see the final impression. And on Teresa, I decided that what I could do on her was do a mock-up resin to try and improve the aesthetics of her anterior teeth. In making my impression, I also moved the teeth inferiorly so that I knew exactly where I would like these teeth to be. This is the first mock-up I did, and just to show you, you may have to do a second one. I didn't like this one, and so I did an additional mock-up on the patient, increasing the length of the centrals and the lateral, final design. On some patients, as I pointed out, if you feel that the tray is inadequate to use as a final impression, you can go ahead and, using the components in the kit that is supplied to you, thermoplastic trays, go ahead and make a new impression. Once the records are made, the impression and the records are now sent to your lab, to Mosky Lab. Rob will scan your impression. He will scan the jaw relationship record. This will be shipped to AvaDent, who, using their software, will relate the impression and the interocclusal record to a mandibular cast. Using AvaDent Connect, which is the software used to set the teeth will be set. Once the teeth are set, the record is then sent to a milling machine where the denture base is milled out, and the teeth are bonded into the sockets that are milled in the puck to complete your denture. And here is Teresa's final denture. And so what we have is an old denture, a mock-up, and then the final AvaDent denture. And I was able to complete this in 2 visits. Teresa was very happy with her prosthesis. We notice now that there's no reverse smile line, and I'm able to provide her with a superior product, in my opinion.
Dr. Finger, may I interrupt you for 1 sec?
Sure.
Yeah, there are a few people that have come on since we started and want to let them know. If you have a question, this is an open forum. If you have a question, just click on the raised hand button and we will unmute your mic and you can ask a question. We don't want people to, I don't want any confusion. If you have any questions, feel free. All right.
Thank you.
Thank you.
Okay, so now we're going to look at the anatomical measuring device and the AvaDent impression technique. In the kit that you'll get, thermoplastic trays are provided, which can be softened at 169 degrees Fahrenheit. The patient comes in with an existing denture. A polyvinyl siloxane cast can be made. Tray selected, come in different sizes. We can select a tray over this cast. Once we've selected a tray, it is placed into the water bath and heated, and then softened and formed on the cast. Once the tray is tried in the patient's mouth, stops are placed into the tray. Here we see 4 stops. This will allow you now to use the impression border molding material, also supplied in your kit. And here we are developing a custom tray. We've got good peripheral roll, a good control of the borders. We now go ahead and, using the wash material, form and make our final impression. And so here we have final impressions for the maxilla and the mandible. Using the thermoplastic trays, we've been able to develop custom trays so that you don't need to go ahead and get that additional step made, and this will reduce your cost. The anatomical measuring device which we're going to use helps determine our occlusal vertical dimension, our centric relation, maxillary lip support. We mark our midline, occlusal plane, and we can actually choose our anterior tooth size, positions, and our smile line. And I'm sure many of you are wondering how we can do this. Well, let me take you into our secret intraoral tracing. This is our anatomical measuring device. The anatomical measuring device consists of an upper tray and a lower tray. On the upper tray you have a pin which can be raised vertically or lowered vertically, and it has a lock nut to lock this into position once the vertical dimension is obtained. Here is the upper tray with the pin resting on the lower tray. In addition, the upper tray has a clear plastic plate which is attached with a screw which can be moved outwards and inwards and help you capture the position of your lip so that the correct position of the tooth, anterior tooth, will be placed for aesthetics. Patient comes in with dentures. So with the current dentures in the mouth, we establish the patient's vertical dimension. The patient is wearing an old set of dentures here, so using clinical judgment, you will want to either increase or decrease this. The maxillary tray is lined, that is selected. You have a choice of 3 tray sizes. You choose the one that will fit over that particular arch. Once it is chosen, you line this with a border molding material, positioning this into the mouth using the midline screw to help you position this, and you try and get this as parallel as possible to the interpupillary line. Sorry, this seems to be double skipping here, everybody. I apologize about that. This is lined with the wash material. Similarly, the lower tray is lined with the border molding material and placed in the mouth. The tray is oriented so the table is positioned at hopefully the horizontal plane of occlusion. The vertical dimension is now adjusted using a screw on the lateral surface of the upper tray, and this, by using this will either raise or lower this pin. Go ahead and confirm whether you have the correct vertical dimension, and once you do, this lock nut is screwed into place so that this pin is stable. Using some form of marking agent, you can use occlusal paper to mark the table, the adhesive that comes in the kit, or alternatively a disclosing spray. The patient will now be directed to move their jaw forward and back and to the left and to the right while maintaining contact with the upper pin on the lower plate. An arrow is scribed on the table with the apex of this arrow being the centric relation position. The tray, a divot is drilled at the apex of this arrow, and the tray is then placed back into the patient's mouth. With a pin in the divot, bite paste is syringed between the upper tray and the lower tray to stabilize this in the centric relation position. The properly adapted anatomical measuring device, lip support, is then placed back onto the upper plate. If there's excess material clumping the lip, this can be removed. The anatomical measuring device, or the AMD, is placed back into the mouth, and the lip support begins to become adjusted. In addition, To ensure that this anatomical measuring device will be aligned correctly by the software, an AvaDent ruler is used, which is placed into the upper tray and aligned to the interpupillary line. Once this is established, and once the anterior component of the tray is positioned in the correct position, the midline is marked and the incisal edge is marked. Using an aesthetic transparency, which comes in 3 sizes, small, medium, and large, which will actually stick on to the anterior component of the AMD, tooth selection size can be completed. The stick-on is used, and this is stuck onto the lip support. And here we see the lip support with the final transparency. The patient is smiling. It gives the patient an idea of what the final restoration is going to look like. So here we have the final impressions and the AMD, which are sent off to your lab. Mike, this is going off by itself here for some unknown reason. I apologize to everybody if the slides are skipping. The AvaDent fabrication procedure follows a similar procedure that you saw with the reference denture. If you wish, at this point, you feel that you would like to have a try-in, an advanced try-in can be done. After milling of the sockets of the base and the intaglio surface, the teeth, rather than being cemented or glued in using resin, can be placed using wax. This will come back to you, and you will be able to try that in and move the teeth. In addition to this, we have what we call a BOMA functional try-in. This is an acrylic milled denture from a single block of ivory acrylic. This will be sent to you. You can adjust the bases. You can visualize changes needed in the tooth position. The patient can actually take this home for a try-in, and then you can begin to communicate any changes that you want to the lab. Here we see that on this particular patient, we've got a good smile line, we've got a good curve to the anterior teeth. The teeth are actually parallel to the interpupillary line, and we can, on this patient, look to check whether the midline is correct and actually check whether the patient is happy with this prosthesis. The patient takes this home, wears this. The teeth will not come out because they're in wax. And then this will be returned to your lab. We'll return this to AvaDent. And from this, they can now go ahead and mill the final restoration and know that the aesthetics is certainly acceptable. And on this patient, we did the functional try-in, and here I show you the finished restoration. Smiles well, the teeth follow the lower lip, and we have one happy patient. So the additional protocols include the AvaDent immediates, AvaDent's a single denture, and the AvaDent all-on-4. For the immediate dentures, you make impressions. Generally, you will use an alginate impression. If you wish, you can make one in polyvinyl siloxane, but you will pour a stone cast. You'll make an interocclusal record. You can use traditional records when there are sufficient teeth that interdigitate, or you can use the anatomical measuring device. You'll mark the midline, the incisal edge position of the maxillary central incisor, and the occlusal plane. Also, you will note on your prescription any adjustment to actual tooth position that you would like. Once sent to the lab, the stone casts will be scanned, and the design that you have submitted will be marked virtually using the software. You will note where you need to have bone reduced. This will be completed for you on the virtual cast, and with a click of a button, the teeth will be removed, as will the bone. And then the bone will be rounded off using the software. In addition to your final denture, an AvaDent bone reduction guide can be sent to you. This is an exact duplication, and I want to stress an exact duplication of the final restoration. Once you extract your teeth, you'll be able to place this into the mouth and reduce the bone exactly to conform to the intaglio surface of your finished denture.
Dr. Israel, just a moment. Let me make a suggestion that maybe you don't use the mouse, you just use the down keys to advance.
Okay, yeah, thank you very much.
Thank you.
There we are. Still popping, Mike. Apologize. The immediate denture is unique. It's precision milled, and you'll find that if you use that reduction guide, you'll be able to get truly a very fine, improved fit, as opposed to one where you are making a guide in the lab to try and fit your complete denture. Trying. There we are. Here is a patient on whom we're going to make an immediate denture. We notice the teeth. Instructions are sent to the lab. Ridges are prepared. And here we have a full mouth extraction, and the immediate dentures are placed in the mouth, and this is at the time, obviously, of surgery. And we're looking at the patient prior to extraction and then the patient post-extraction. The AvaDent process for a fixed detachable implant system, or some of you might call it an AvaDent all-on-4 if you so desire, in the hands of different clinicians, different numbers of implants can be used. Mike, you want to control this? It's coming along. Okay. The advantage of the AvaDent all-on-4 system is that once you make your original AvaDent, then the digital component of the prosthesis will provide the same base form and tooth positions throughout the process. You'll have a very dense material. You'll be able to, at each appointment, do the clinical step that you desire. You can have greater strength. We can make a monolithic, fully milled hybrid. This is that the denture is milled from one puck of resin, where you have the base and the teeth milled so that you have a one piece. You obviously have a permanent digital record. And finally, when you finish your final restoration, the titanium bar is incorporated into the base using a high pressure technique that creates a monolithic resin base. Milled denture teeth that AvaDent can produce do provide a very natural appearance, increased strength, and a very customized type of occlusion. So let's have a look at what you can get and what the components are when you make an AvaDent all-on-4. Certainly, if you decide to do this, you can do a guided surgery procedure. I think what I'd like to show you is the freehand surgery package that is available from AvaDent. You would make your records for your patient. Here is the anatomical measuring device, the wash and final impression or a wash in the final duplicate denture here, or you can use an anatomical measuring device. This is a patient that has teeth. Teeth are going to be extracted from the cast generated virtually. An AvaDent reduction guide is made, as is the provisional prosthesis. A locking device to ensure that when the dentures are placed in the mouth, centric relation will be maintained, as will the vertical dimension. And from there, the provisional denture will be made and screwed into the mouth. At the time of making the provisional denture, you will use this to make a quick set cast, and on this, AvaDent will make an index to verify that the implants are in the correct position at the time of impression making, and you actually get a clear acrylic AvaDent which duplicates the exact AvaDent denture which was originally made. This is an AvaDent implant record device. The final impression is made in this. The index is picked up. Send this to AvaDent to pour a stone cast, and if you desire, an aesthetic try-in can be milled. This really is an aesthetic try-in, and from there you will complete the restoration. There are many different packages that you can obtain through Mosky Lab. If the patient comes in with an existing hybrid restoration and you simply want to go ahead and use the existing bar and replace teeth, this is possible. A jaw record will be made against the opposing cast. The bar will be removed, and this denture or hybrid prosthesis will be recorded by scanning, and from there teeth will be removed off the bar, new teeth will be placed, and a final restoration can be made. So all of this can be done using the AvaDent system. If you so desire, certainly guided surgery is available. One additional step will be used there, where a scanning guide will be sent to you, plus obviously the guided surgical guide which you can use. So finally, there are a variety of components which you can use from AvaDent, which will fit your practice. But the most important reason to use this is that all the restorations and all the guides which you will make will be based upon the original AvaDent which you will make. So the lab has different packages for you. Here we have a scanning guide that can be made, a bone reduction guide, a locking device. If you're using guided surgery, this would be the stent that you would go ahead and use. And if you're using guided surgery, AvaDent will also provide a provisional restoration with cuts already made in it, so that after picking up your copings, very little reduction of the denture needs to be made. And then finally, AvaDent has a proprietary method of scanning the final denture, having the bar made, and having this retrofitted into the denture to lock it into almost a one-piece prosthesis. So what does this mean to you? Well, if we look at the cost of an AvaDent denture, then this would amount to about $658 as compared to the denture that you would pay if you were making a conventional one. However, the number of appointments that you utilize to make the AvaDent is greatly reduced. Ordinarily, you will use at least 5 appointments to make a denture, with the AvaDent using the reference denture technique or the AMD technique, you should be able to complete this in two visits. And again, I stress that there is a learning curve, but once becoming fully acquainted with the system, I think you'll appreciate the fact that your gross per appointment will certainly be increased. So from an AvaDent gross of this amount, you will certainly net a much more than a regular denture which you will be making. The AvaDent on 4 profitability can truly skyrocket for you, improve your profitability. According to the, let's have a look at how many dentures you may be expected to make in a year. According to the ADA, a general dentist produces about 41 dentures annually. If you're using the AvaDent system and you increase the numbers of dentures which you made in your office, then by virtue of the fact that you are increasing the amount of income that you make per visit, your growth should improve quite dramatically with this system. You can do the math. Certainly, if you did 75 arches at about $1,500 an arch, then you would gross a certain amount. And then you can compare how much you might gross using the different techniques that are available. There are marketing materials available. Your laboratory, Mosky Lab, and AvaDent will aid you in getting these into your office. There are letters to introduce your patients to the system. Certainly, if you're using it, I use it in my office. We're developing a new web page right now, and I am becoming an AvaDent provider. And I state that, we'll be stating that on my web page, because I'm finding that it certainly does decrease my time to make one of these, and I'm certainly providing, in my opinion, a very fine restoration using superior materials that are available. To make the AvaDent using the anatomical measuring device, this will come in your kit, and in the kit there are all the materials that you will need to complete the restoration. In addition, you will get a Lang's duplicating kit. Here is the hard putty that will set to make your model. You get 3 different types of impression materials: the bite paste to help make the centric relation record, the wash material, the border molding material, obviously pamphlets which you'll be able to place in your office, trays, you get calipers to measure vertical dimension, and also included will be a thermometer. I hope I've been able to convey to you that this truly is a novel system. I believe if you use it in your office, you will find the time that you take to make a denture will decrease dramatically, and I also believe that you will find that you'll be able to provide a superior product to your patient. It's interesting, in surveys that have been done, asking patients questions who have had dentures made, one thing that stands out is that patients do not like coming back for appointment after appointment to make the prosthesis. This system cuts those appointments down. If there are any questions, I'd love to be able to answer them. I hope that I've been able to bring new information to you, and I hope that you too will enjoy joining the digital age with complete dentures.
Rob, are you there? Rob?
Yeah, I'm here. Somebody muted me, but can you hear me now?
Yes.
There we are.
Okay. We're
Robert,
back again.
handing it back to you.
Yeah. Okay. So thank you, Dr. Finger. You guys hear me? Unmuted.
Yeah.
Okay. Someone is muting and unmuting, and it must be my wife. And unless my wife is out there, stop unmuting me or muting me. So once again, I want to thank Dr. Finger for spending his valuable time with us. I want to thank all the participants and attendees for spending your valuable time. And as a result, I'd like to offer, the kit is $799. I'd like to offer $100 off for those of you who are participating today. You have till Friday to let us know that you'd like a kit, and we have them at the lab, so please let us know. Do you need a kit to do one of these? No, you don't need a kit. It's much better to have it, but you don't absolutely have to have it. Are you going to save money? You're going to save time. You're going to save money, but most importantly, from what we've noticed, these things really work. We've invested, like everyone has, in technology over the years that kind of worked, sort of worked, or ended up collecting dust on the shelf. And with this AvaDent system, we see when we get good records, that's the important thing, because it's so incredibly accurate that if the records aren't really, really good, you're not going to get the result you're looking for. But it's going to be so much better, even if they aren't great, than anything you had before. You know, the dentists that we've done this for are really blown away by the results. And I'm not just saying that. And so if you buy a kit, or if you want to do one of these cases and you're a little skittish, we're happy to come to the office and walk you through one, do it on the phone, or however you want to do it, because we've seen the results, and we want to make sure that you're successful. So that's what I can offer you. And so if there are any other questions, please let us know. Give us a call. No one seems to want to talk today. Everyone's shy. Or you've got food in your mouth because you're eating lunch. So however that is, thank you for being here, and please feel free to give us a call with any questions you'd like. Mike?
All right. Sounds great. We appreciate everybody's participation, and we'll now end the webinar. Thank you.